Welcome to the Perspectives on Healthcare podcast, where members of the medical community from different roles, venues, and locations share their unique perspectives on quality healthcare, its future, and how to improve it. Now, from the Your Keynote Speaker studio in Pittsburgh, Pennsylvania, here is your host, Rob Oliver.
Thank you, and welcome to another Perspectives on Healthcare. Today's perspective is an international flavor, and if it has a Mediterranean feel to it, that's good. It's because it comes from a primary care physician located in Greece. His name is Georges Kanellopoulos, and he is a member of the Generation X. Georges, welcome to the podcast, my friend.
Hi, Rob. Thank you so much for your invitation.
You bet. So just for clarification, you are practicing both in Greece and in Ireland. Am I properly understanding that?
That's correct. Yes.
Okay. So just tell me a little bit about yourself and your role in healthcare, please.
So I was involved in healthcare because I always loved to study something in the life sciences. So that's far back. Since then, medicine, it's not just a life science. It's also caring, it's also healing and giving. But the thrill of the puzzle, the science part of it is still a part of being a doctor.
Okay. So I find it very interesting because I did a interview marathon with patients, talked to 137 patients, and asked them to identify healthcare heroes. And when they talked about healthcare heroes, most of what they talked about were what I would classify as soft skills. You said it's about caring and it's about giving as much as it is about the life sciences part. Can you talk a little bit about that? What are your thoughts on that differentiation between the caring and giving side and the life sciences side, and kind of finding the balance there?
So yeah, that's very interesting. For me, it's two sides of the same coin. So you do something because you like it, and then you like it because it's what it is. So, I mean, you like it more because it's caring and giving. That's how I imagine it right now. So, for instance, I'm part of a group named Valiant Group, and it's healthcare professionals that have sessions, and it's based on group therapy, and they discuss their role as a healthcare provider towards a patient. So we always discuss our relationship with the patient. And we see always that we go back and forth between being a scientist and being a human being who's caring, and how much you care, what other feelings you have. And that's very interesting because we explore this thing that you said right now, the two sides of the same coin.
Got it. So what I'm hearing, the discussion is what you do is extremely important, but the way in which you do it has a high degree of importance as well.
Yeah, and it's also fun.
It's also good. So let me ask about this, because I'm not familiar with the Greek healthcare system. I understand the UK has more of a socialized medicine. Can you talk a little bit about the healthcare system in Greece?
Yeah, sure. So I don't like to describe it as a system. It's not very organized.
Okay.
Because we don't have primary care. We don't have organized primary care. So also specialists can do private offices, so they have primary care as well. And that's the main reason I don't call it a system, because we don't have the communication. A patient can go to my office and then go to another doctor's office and see another couple of doctors and call it a day. So they don't have to have one doctor. Does it make sense?
Yeah. So there, the patient is kind of the hub in the system, right? Where the information comes to them, and then they can go somewhere else, and more information comes to them. But there's no communication in between the professionals that are practicing. Can you comment at all about who is the payer in the Greek healthcare system? Is it the government that's doing the paying? Is it private insurance? Is it the individuals paying out of pocket, or how does that work?
It can be mixed. So it's usually out of the patient's pocket. There's also kind of sufficient public sector where you can go and have everything for free, but it's not so efficient if you have to do more elaborate things. So for the basic stuff or for emergency, you can go to public sector, no problem at all, and you don't pay a dime. But private sector is what you usually mean when you are saying, I'm going to my doctor.
Okay.
And you can also go to the specialist, as I said before, no referral letter needed, but also no communication between the healthcare providers.
Got it. Okay. What does quality healthcare mean to you?
Quality care, I imagine it as a circle, the kind of circle with the patient in the center. And what I see is everybody else is on the periphery of the circle. So I'm a primary care provider, and there's the nurse, the physio, the specialist, the hospital. And every time the patient is meeting one of us, we kind of go to the center with the patient, we dance. And then we go back to the circle. But having a circle means you communicate, and that's the very important part. And if you miss that, you break the circle.
Okay. So there's the communication that goes around the circle, and then there is the interaction within the circle. And I love your analogy. You go to the center and you dance with the patient, you engage with them, and both of you are engaged in that process. It's not just the patient by themselves. Can you give me an example of quality healthcare?
Quality healthcare in practice means that you listen. As a healthcare, you just listen to what the person wants to say. And it's plain as that. If you give 2 minutes to the patient to explain themselves in the beginning of the consultation and actively listen, then you may never miss a thing. It's all there in the first 2 minutes.
Got it. It really makes sense from this viewpoint. Who knows what is going on in the patient's experience? Who can explain their symptoms? Who can explain what their experience is better than they can? And so it's important to ask the questions, but then to allow them to fully explain or to fully share what's going on. And can you talk to me about when you say actively listen? What do you mean by that, and how is that different than maybe just your everyday listening?
So active listening is also part of sales skills, and it's one of the most important soft skills as a healthcare provider. It means that you not just listen, you encourage them to speak. So you encourage them to explain themselves, and then you start asking open questions, like not yes or no questions, but what if questions, or what's that you can explore better question. And then maybe you can close the questions towards what you're feeling is your role in that session is. And you do closed questions later, but first you have to listen to what they're trying to say and explore the mind.
Got it. So, and I love that idea where you're encouraging them to speak, you're exploring what's going on with them. And sometimes there is a rush to judgment almost, or a rush to diagnosis, to say, okay, how quickly can I hear what they're saying and then put the pieces together, get the diagnosis, get the plan of treatment done, and then send them on their way. But you're talking about making sure to fully actively listen and engage with what's going on with them, to make sure you're hearing everything and that you are giving them a plan of treatment that's going to work well for them. Okay, good. What do you wish people understood about your role in healthcare?
Giving up control. I will explain myself. When you go to someone who provides services and is a professional, you have to give up some control to them. So you have to trust that they know some things better and they're here to help you. And for instance, if I'm going to the healthcare provider and want to hold all the information or want to control the session or the what's going to happen, and tell them, give me this medicine or prescribe me this or the other labs. And this is something that happens very much in Greece. That's why I'm mentioning it. You're not giving up any control. But on the other hand, the healthcare provider has to give you control. And by giving control to the patient means you have to strengthen them and figure out what's important for them. So for instance, why are you worrying about which lab tests I will order? Shouldn't you be worrying about what can you make better on your end? Like eating healthy habits, etc.
Yeah, I really appreciate what you're saying there, because you're giving both sides of the coin again, right? The patient needs to be able to allow the practitioner to have control, to say, okay, the practitioner knows more about medications and knows more about labs and so on. But at the same time, the practitioner has to be willing to allow the patient to have some input as well, to talk about, what is it that's going on in their life, to also talk about options that they can have and that they can make, to say, okay, are there things you can do to improve this without even involving medication? So it sounds to me like there's two sides of the same coin again there, which is a viewpoint that I appreciate. So thank you for that.
It's the dance, isn't it?
It is. And in although, they talk about here in the United States, it's Fred Astaire and Ginger Rogers are the classic ones from the movies who were dancing. And the reminder is that as wonderful a dancer as Fred Astaire was, Ginger Rogers did everything that he did backwards and in heels. So there is there's got to be an appreciation for both partners and the role that they play in the dance. So it's a great analogy. Yeah. What excites you about the future of healthcare?
I don't think anything excites me. I'm just following the vibe. I don't know where healthcare is heading to, and there's many obstacles like lack of doctors in many countries of the Western world, and that's going to be a problem. And the aging population is going to be a problem with no doctors, no nurses, no healthcare professionals to treat all those people. But something that's going to ease the way to it is telemedicine and remote work and all that we're already doing, and not in any fabulous way like robotic surgery or doing surgery from home, just plain consultation where you don't have to bring the patient in from 40 miles away, or just doing simple stuff from the office and the patient is at their ease of their home. And that's exciting because
Yep.
you're doing more.
Definitely. I think about, listen, I'm a person with a disability and transportation can be an issue for me. So having the ability to do the telemedicine allows the interaction to figure out, do I actually need to go to the hospital, or is this something that can be treated at home? Is this something that can be diagnosed through a video conference? And yeah, it opens up a whole realm of possibilities. And yet, as we have learned with Zoom meetings, there is still a value to that face-to-face experience that we can't forget about. But I agree in the fact that telemedicine is really a step forward in making things easier, more accessible. But we can't forget the face-to-face side of things. Last question for you. What is one thing medical professionals can start doing today to improve the quality of healthcare?
I have just one thing in my mind. It's spending more time with the patient. And you can, as a healthcare professional, you can always explore a business model in your practice that you can allow more time to your patient. And you can provide that as an alternative. If you're private like me, you can say, listen, it's no 15-minute consultation, it's 30-minute consultations, or it's as many minutes as you need. And that's what I'm offering you. And in the market, it can hold as a vital alternative model.
Yeah, so interesting what the patients need, and in some ways what practitioners need is more time. Well said, and a great way to end our conversation. Listen, Georges Kanellopoulos, thank you so much for joining me today. I appreciate you being here. I appreciate you sharing your perspective on healthcare. Just a reminder for all my listeners that we are still having issues with Apple Podcasts. There are 2 feeds for the podcast on there. If you want to make sure that you are subscribed to the correct one, please go to the website, perspectivesonhealthcare.com, and the correct link is there. The wrong link, the wrong feed will be going away at the end of the year. So just make sure that you're subscribed to the right one so that you don't miss anything. Again, thanks for being here, and thanks for listening to this Perspective on Healthcare.
Thanks for listening to Perspectives on Healthcare. Visit perspectivesonhealthcare.com to learn more about Rob Oliver or to subscribe so you never miss an episode. If this podcast was valuable, we'd appreciate a review on iTunes. Or if you tell a friend or coworker about the show, that would be helpful too. Join us again next time for more Perspectives on Healthcare.